Colon cancer was once considered a disease of the old, a condition that primarily affected those who had already lived the majority of their lives. It was a disease that cast its shadow on those in their twilight years, a grim reminder of the frailty of aging. Today, that shadow has shifted dramatically. It now falls upon a new generation, young adults in the prime of their lives who should be focusing on building their futures. The rise of colon cancer in people under 50 is an alarming trend that has caught the medical community by surprise. This rise is a stark reminder that cancer does not discriminate by age, race, or lifestyle. This new epidemic demands our immediate attention and action. We need to understand why this is happening, delving into genetic, environmental, and lifestyle factors. We need to develop new strategies for early detection, ensuring that screenings are accessible and encouraged for younger populations. Most importantly, we need to improve care for these younger patients facing a life-altering diagnosis, providing them with comprehensive support. This is not just about treating cancer. It's about addressing the holistic needs of the patient. It's about understanding the long-term consequences of the disease and its treatments, and how they impact the quality of life. It's about ensuring that young survivors of colon cancer have the chance to live long, healthy lives, free from the shadow of their past illness. Their future depends on it, and so does the future of our society. We must act now to protect the health and well-being of the next generation. The link between cancer and cardiovascular disease is becoming increasingly clear. This connection is not just a minor correlation, but a significant health concern that demands attention. This link is especially strong in young adults diagnosed with colon cancer. These individuals, often in the prime of their lives, are facing dual health battles. These patients face a significantly higher risk of heart problems. The stress of a cancer diagnosis combined with aggressive treatments can take a toll on the heart. This risk persists for years, even after successful cancer treatment. Long-term monitoring and care are essential to manage and mitigate these risks. This increased risk is not a coincidence. Research shows that the treatments designed to save lives can also have unintended consequences on the cardiovascular system. Cancer and its treatments can have a profound impact on the cardiovascular system. The heart, being a vital organ, is particularly vulnerable to these effects. Chemotherapy, while effective in killing cancer cells, can also damage the heart muscle. This damage can lead to long-term cardiac issues that require ongoing medical attention. Radiation therapy to the chest area, often used to treat colon cancer, can also injure the heart. The radiation can cause inflammation and scarring, which may compromise heart function. The impact of these treatments can manifest in different ways. Each patient may experience unique challenges based on their treatment regimen and individual health factors. Some patients may develop heart failure, a chronic condition where the heart is unable to pump blood effectively. This can lead to fatigue, shortness of breath, and other serious health issues. Others may experience arrhythmias, irregular heartbeats that can be life-threatening. These irregularities can cause palpitations, dizziness, and even sudden cardiac arrest. Still others may develop premature atherosclerosis, a buildup of plaque in the arteries that can lead to heart attacks and strokes. This condition can significantly reduce the quality of life and increase mortality risk. The first 2 years after a colon cancer diagnosis are a particularly vulnerable time for young patients. During this period, the risk of developing cardiovascular complications is at its highest. This heightened risk is likely due to a combination of factors. The body is still recovering from the initial shock of cancer and the aggressive treatments used to combat it. The immune system is weakened, making patients more susceptible to infections and other complications. The psychological stress of a cancer diagnosis and the long road to recovery can also take a toll on heart health. It is crucial that young colon cancer survivors receive close monitoring of their cardiovascular health during these critical 2 years. This includes regular checkups with a cardiologist, blood pressure and cholesterol management, and lifestyle modifications to reduce risk factors. Aggressive treatments like chemotherapy and radiation are essential for fighting colon cancer. These treatments can be life-saving, offering hope where there was once none. However, these treatments come at a price. Chemotherapy drugs, while targeting rapidly dividing cancer cells, can also damage healthy cells, including those in the heart. This damage can weaken the heart muscle, leading to heart failure over time. Certain chemotherapy drugs are known to be particularly cardiotoxic, meaning they carry a higher risk of heart damage. Radiation therapy, especially when directed at the chest area where the heart is located, can also injure the heart. Radiation can cause inflammation and scarring of the heart tissue, making it less efficient at pumping blood. Young adults diagnosed with colon cancer often face a more aggressive disease. This is partly because the symptoms of colon cancer in younger people are often attributed to other, more common conditions. This delay in diagnosis often leads to the cancer being diagnosed at a later stage, requiring more intensive treatment. Late-stage colon cancer often necessitates higher doses of chemotherapy and more extensive radiation therapy. While these aggressive treatments are necessary to control the disease, they also increase the risk of long-term side effects, including heart problems. This underscores the need for greater awareness of colon cancer symptoms in young adults. Early detection is crucial. It allows for less aggressive treatment options and reduces the risk of long-term complications. Section 6. A Tale of Two Patients: Racial Disparities in Cardiovascular Risk. Racial disparities in healthcare are a persistent and tragic reality. Sadly, these disparities extend to the realm of cardiovascular risk in young colon cancer survivors. Studies have shown that young Black patients with colorectal cancer have a higher risk of cardiovascular mortality compared to their white counterparts. The reasons for these disparities are complex and multifaceted. They likely stem from a combination of factors, including differences in access to quality healthcare, socioeconomic status, environmental exposures, and genetic predispositions. Addressing these disparities requires a multi-pronged approach. We need to ensure equal access to high-quality cancer care and cardiovascular screenings for all patients, regardless of race or ethnicity. We need to address the social determinants of health that contribute to these disparities. Section 7. Bridging the Gap: Oncology and Cardiology Working Together. The complex interplay between colon cancer, its treatments, and cardiovascular health necessitates a collaborative approach to care. Oncologists, specialists in cancer treatment, and cardiologists, specialists in heart health, must work together seamlessly to ensure the well-being of young colon cancer survivors. This collaboration should begin at the time of diagnosis. Cardiologists should be involved early in the treatment planning process to assess the patient's baseline cardiovascular risk and recommend strategies to minimize potential damage from cancer therapies. This collaboration should continue throughout the course of treatment and into survivorship. Regular cardiovascular screenings, lifestyle modifications, and appropriate medical interventions are crucial for mitigating long-term heart risks. Section 8. The Unanswered Questions: A Call for More Research. While we are beginning to understand the link between colon cancer and cardiovascular disease in young adults, much remains unknown. More research is urgently needed to answer critical questions. We need to better understand the precise mechanisms by which cancer and its treatments damage the heart. We need to identify biomarkers that can predict which patients are at highest risk of developing cardiovascular complications. And we need to develop targeted interventions that can prevent or mitigate heart damage in these vulnerable patients. Investing in research is investing in the future. It's an investment in the lives of young colon cancer survivors who deserve a long and healthy life. Section 9. A Message of Hope: Early detection and prevention remain key. While the increasing incidence of colon cancer in young adults is alarming, there is hope. The medical community is working tirelessly to understand the reasons behind this trend and to develop effective strategies to combat it. Early detection of colon cancer remains the most powerful weapon we have. Regular screenings, such as colonoscopies, can identify precancerous polyps and early-stage cancers before they become more serious. When caught early, colon cancer is highly treatable. Treatment options are more effective and less invasive, leading to better outcomes for patients. The earlier the diagnosis, the better the chances of survival and the lower the risk of long-term complications, including heart problems. Prevention is equally important. By taking proactive steps, we can reduce the incidence of this disease. Adopting a healthy lifestyle can significantly reduce the risk of developing colon cancer. This means making conscious choices every day to support your overall health. This includes eating a balanced diet rich in fruits, vegetables, and fiber, maintaining a healthy weight, and staying hydrated. Engaging in regular physical activity is also crucial. Exercise helps to keep your digestive system functioning properly and can reduce inflammation. Additionally, avoiding smoking and excessive alcohol consumption can lower your risk. These substances can cause damage to the cells in your colon and lead to cancer. We must empower young adults to take control of their health. Education and awareness are key components in this fight. Be aware of the symptoms of colon cancer. These can include changes in bowel habits, blood in the stool, persistent abdominal discomfort, and unexplained weight loss. Don't be afraid to speak to a doctor if you experience any unusual or persistent digestive issues. Early consultation can lead to early diagnosis and better outcomes. Early detection and prevention are our best bets against this devastating disease. By staying informed and proactive, we can make a significant impact on our